My mother wasn't given a chance.
The daughter of Lydia Gordon, a 94-year-old resident at Montreal's Vigi Mont-Royal private long-term care facility, is speaking out about her mother's death.
She was fine. She was okay. She had an issue in January. This was a temporary situation. I had super conversations with her. She translated from German to English for me. I mean, she was completely fine.
Lori Gordon says she was called April 18th, told to come to the facility because her mom was dying. Once she arrived, she was told it was not urgent and she couldn't see her. Next day, the same thing. A call saying her mother was end of life. She called 911 trying to get her mom transferred to a hospital. She says the operator would not send an ambulance, but sent police.
A policeman is going to talk on my behalf about my mother in a place that I cannot access.
We spoke to a nurse who was brought in to help at Vigi Mont-Royal. She spoke to us anonymously, fearing repercussions. She says she also had difficulties transferring patients from long-term care to hospital.
I know there's some hospital and 911 people that are refusing transfer, but it's not being comprehensive of the situation right now.
Lori's sister was able to stay by her mother's side until she died April 21st. She says they couldn't get straight answers about their mom's condition. Told she had been tested for COVID-19 and they were awaiting results, and then told by the doctor, who she says didn't physically work on site, that she was in fact not tested for COVID-19.
She told me, I am in charge of 4 CHSLDs. I'm a doctor at four separate institutions.
The nurse says residents with COVID-19 were not isolated from others. She says over 150 patients currently have COVID-19, and she believes most are positive, but there's a lack of tests. She says there's been several deaths as well.
More than 20 in the past few days. We can't protect any resident. It's too late.
Lori says most nights there was one nurse on staff for some 50 patients.
When I went to talk to the nurse who didn't let me in, she started to cry.
The nurse we spoke to says several staff members are sick because they did not have access to PPE. She says hospital nurses are now there to help.
It's the hospital that brought all the equipment to protect our staff, so I can guess that the people working that used to work there got sick because they didn't have the right equipment.
When Lori received a call from the doctor that her mother passed away, she was told the funeral home needed to come get the body immediately, that it could not wait for the morning.
I said, I don't have it. I'll give it to you in the morning. She goes, I need it now. Like that.
Vigi Santé, which owns this home and several others across the province, said doctors are on site unless they're 70 or older, adding despite staff shortages, they have assured basic care and have not run out of PPE. They say all residents have been tested for COVID-19.
Well, some people have a lot of talking to do, and it has to be in front of a judge and a tribunal. This has got to be investigated.
In Montreal, Tina Teneri, Yellow City News.